Welcome everyone to the HSPN Health System Performance Network introductory webinar on evaluations for OHTs. I would just like everybody to use the chat box. Thank you for joining. And if you could use the chat box to just introduce yourself and say who you are and where you're from. Thank you very much. Welcome everybody to our webinar introducing the OHT evaluation program. Thank you very much for joining today. And I think actually that we are slightly oversubscribed. So there may be a few people who will be only watching this after the fact or on Thursday, but we'll also be posting this onto our YouTube after today's webinar. My name is Walter Wochis, and I'm the Principal Investigator for the Health System Performance Network and co-lead for the evaluation in the Ontario health teams across Ontario. We're going to give you a bit of an overview today of what the intentions are, at least in this formative phase of the evaluation of OHTs. So an introduction to our team, an overview of the evaluation, some of the timelines, what participation involves, and what our intentions are to use the data in the first pass. And then we'll have a nice, quite a bit of time for Q&A, which is the primary purpose of today's discussion. And so without further ado, I would first like to introduce our team. So as I mentioned, my name is Dr. Walter Wochis, and I'll be co-leading. And we're actually going to let everybody see everybody's real face today. So we're going to do a little round table at the team, and we're all well represented. So first, I just want to pass it down. We're not very sophisticated, so we're just going to pass our camera down to the team. And we're going to start with Dr. Ruth Hall. Dr. Ruth Hall is a member of the Health System Performance Network at the University of Toronto and co-lead for the Central Evaluation. Also assistant professor at the Institute for Health Policy Management and Evaluation at Dalla Lana School of Public Health, and an ICES adjunct scientist. Prior to joining the HSPN, Ruth was the evaluation lead for Ontario Stroke Network for 10 years.
Thank you, Walter. It's a real honor to be part of this team and co-leading with Walter on this fantastic initiative the ministry has launched, and you have all gladly agreed to participate. So look forward to working with all of you in the coming months. And I will just say my bias is a bit towards the quantitative side of things.
Lovely. And Guy Mboldania, many of you may have met Dr. Mboldania in our past work. She's a cultural anthropologist conducting qualitative research in the Health System Performance Network. She has worked in qualitative evaluation with us on integrated funding models and published a seminal paper in the Millbank Quarterly on integrating care. Gaia says she's looking forward to learning what the health teams are all about.
I certainly am. So I'm going to be working on the case studies aspect of this, so the interviews really, and I look forward to perhaps speaking with some of you. Okay.
Lovely. And hang on to that for a second, Gaia. We're going to go to Shannon Sybil. Can Shannon come on with her camera if she can right now? Lovely. Yep. Shannon's assistant professor at Western University, member of the Health System Performance Network, and a member of the qualitative research team for the Ontario Health Team. Shannon, maybe you could just introduce yourself.
Yeah, hi, it's wonderful to be here. I'm really excited to be part of this team. Again, excited like Gaia to meet and chat with some of you. I'll be working with the qualitative case study. I've also been involved with some of our document analysis, which I'll be talking about a little bit more as we get through this presentation. I'm in London, Ontario, which is why I'm not with the group down in Toronto, based out of Western University.
Thank you very much, Shannon. And now we're going to introduce you to some of our other team here. So Amanda Everall is research coordinator at the Leslie Dann School of Faculty of Pharmacy at U of T, and experience using qualitative methods to explore stakeholders' experience with and perceptions of different integrated care models, including Ontario's integrated care models, integrated funding models for COPD and CHF, as well as the HealthLinks approach to care.
Hi everyone, great to meet you virtually, and I'm looking forward to participating in some of the interviews. I'll be working with 4 different teams on the qualitative side of things.
Thank you very much. Next, we have Jennifer Gutberg, who's a PhD at the Institute for Health Policy Management and Evaluation and a member of the Health System Performance Network. Jennifer's prior work with HSPN has focused on evaluating models of integrated care from an organizational lens, primarily through use of qualitative methods, including work evaluating the the provincial integrated care and coordinated care efforts such as Health Links and the integrated funding models.
Thanks, Walter. Hi, everyone. As Walter mentioned, I'm going to be working on the qualitative piece of this evaluation. So as Guy and Amanda said, looking forward to hopefully speaking with some of you and getting to know the work of your teams a little bit better.
Wonderful. I'd like to next introduce Kevin Walker. Kevin Walker is a Senior Research Associate, Health System Performance Network at the University of Toronto and appointed analyst at ICES. He's worked on evaluations of integrated funding models of hip and knee and bundled care, as well as our other work with HealthLinks. So I've been working with Kevin for over 10 years on various aspects of research, and so happy to have Kevin as part of this team.
Yes, thanks, Walter. And so I'm going to be involved in the survey data collection and analysis. So I will be in contact with all 30 teams very shortly.
Very shortly, you'll hear lots from Kevin, and hopefully the surveys that we've set up will work smoothly for everybody. Thanks, Kevin. Finally, but not least, I would like to introduce Nusrat Nessa, who's a research coordinator at HPME at the U of T and with the Health System Performance Network. She has experience in patient and caregiver qualitative research and engagement, as well as development and testing of patient and caregiver survey measures over the past few years.
Hi, thank you. So I'll be working mainly with patients and caregivers throughout all of the OHTs and conducting qualitative interviews with patients and caregivers. Thank you.
Welcome. Thank you very much. Okay, and so now we're off to the races. That's the team you'll be seeing and hearing from in a very focused and individual way in the next few lines. I see a comment about some people being unable to get sound through the web and the phone lines are full. Well, we're doing the best we can. Hopefully most people will be able to hear online, and if not, this is being recorded and will be available after, and we're running another one of these on Thursday. This was the max lines we were able to get, and there are a lot of people out there, which is wonderful. Okay, I would like to start off with just a high-level overview of the central evaluation. One thing that we are very cognizant of across the 30 teams, and it's all 30 teams that will be involved in this first phase, everybody who is interested in being an applicant. And we've read through many of your, all of your applications, and we can really say that we have varied groups of providers participating as part of Ontario Health Terms. And while there are some common groupings, there are varied first-year target populations. And something that is absolutely true, and it's really amazing how many teams have come together across Ontario and from very different organizations representing different resources, tools, and approaches that will be brought to bear in the next few years as you're starting to implement your Ontario Health teams. Cognizant of this, at the highlight for us is that evaluation must be flexible and will iterate and change over time, and evaluation should be local. So we're going to work to support you in local evaluation and not be some distant, afar team as much as possible. I'd just like to introduce that over the phase of the next few years, we're going to spend almost all of our time today talking about the immediate first few months, and that's this phase 1, which is a formative evaluation of applicant OHTs, known as cohort 1 of the OHTs. And we're going to be undertaking, we'll explain what we mean by formative evaluation from now through March. And after that, in the next few years following, we'll be moving to a more of a maturity model as the developmental evaluation begins across the candidate OHTs. And that will really start in April of the coming year and move forward from there. And we'll be having just a touch on that today, but mostly we'll talk about that first formative phase. And so I can pass it over to Ruth to kick off and lead us through the first couple of entry points.
Thanks, Walter. So as just mentioned, this is the first phase and looking at all the 30 applicants. And it's taking place as of now and proceed into the next new year. Next slide, please. So what is formative evaluation? Its purpose is to improve the design of your model that you are thinking about developing for your target populations to better achieve the intended outcomes. And so that we can, the purpose of it is to understand the context and conditions that are necessary to support implementation of the OHT for creating a patient-centered integrated care, and population-based health management. And it really is focusing on your program activities that are essential to implementing this new model of care. It will result in a descriptive understanding of your key success factors and barriers to success in implementing this new model of care. And from this description, you will be able to modify and adjust your logic to the model of the care that you've come up with, and as well make recommendations for changes in activities that need to take place. Next slide. So the objective is to characterize the 30 OHTs to have a better understanding of the essential ingredients for integrated care and to have a collective impact. So specifically looking at the leadership, communication, partnerships, collaboration, relationships, trust, teamwork, and also getting into some governance. Next slide. And this formative evaluation requires us to look at, use 3 sources of data. First being the document reviews, specifically right now it'll be the full applications. And then we will conduct a survey of the applicants, and we've selected some OHTs that will be invited to participate in interviews for our case studies. Next slide. So the document review is been led by Dr. Sybil, and its purpose is to look at all those full applications, which you know how extensive they are, to produce some high-level summary of these applications, and that we can compare and contrast the applications across factors for integrating care and population health management. So looking at those 8 building blocks of care that you've become familiar with through the RISE platform. It will also inform our interviews and avoid asking questions that we need to ask in the that can be answered from the documents themselves. And it will also develop a baseline understanding of your plans and the goals, and provide the context for subsequent analysis as the transformation takes place. And then we go into our survey. We'll be surveying all the applicants for the 30 OHTs. And the purpose of this is to measure the nature and extent of the partnerships that have been established, looking at how collaborative leadership is being developed, trust, resources, how you come up with a common vision, looking at your teamwork, how you're communicating, readiness for change, and also to look at some governance. So who is going to be surveyed? We are asking that we have representatives from all the 30 teams from the organizations listed as signatories on Section 7 of the application. So we know that the application did require board signatures, board member signatures, but for those organizations that only provided a board chair representative, we are asking for the most involved, the individual who is most involved in the application process for that particular organization. So if you've opened up your Excel file, that's why some of those organizations have a blank with the name affiliated for that organization. Next slide. So what are we going to do with all this data? Well, we're going to characterize the strengths and limitations of the applicant OHTs across those factors that are essential to supporting implementation of an integrated care model, and also describe the variation in the factors within the OHT members and across the applicants. And this will help identify areas for improvement for the teams as they move forward. Next slide. I'll pass now over to Gaia, who will give you some details about the 12 OHTs that are selected for case studies. Gaia.
Thank you, Ruth. Okay. So we selected 12 OHTs for case studies to really help us take a closer look at the process of early OHT formation. So how were these 12 selected? Well, first we stratified OHTs, and then they were randomly selected based on 2 specific criteria. So first was geography. So we tried to get a spectrum of rural all the way to urban geographies. And secondly, we focused on the sector of the primary contact on the application. So hospital versus all the other sectors. Are we still connected? Great. Okay. So we are well aware that this does not necessarily coincide with the lead organization, and perhaps some OHTs may not even have the concept of a lead organization. But it was simply one way of starting us with the process of classifying sites to try and include a representative sample of sectors involved. Okay, so essentially the sample includes a range based on geography and sector of primary contact. So next slide, the goal of interviews. So we're really trying to understand the work that was involved in coming together as an OHT for these 12 teams. So particularly we're interested in understanding the strategies used, the challenges faced, and the facilitators in fostering partnerships, common vision, trusting relationships, clinician and patient engagement, and generally what were the processes, practices, and systems that were already in place to start you off on this journey of care delivery transformation. What have you had to do to tweak things, to perhaps completely revamp things? And what are your plans for continuing this work in the future? So what we're really hoping to do with all of this is eventually present these results in the form of a vignette, so a nuanced, multi-layered picture of the complex process of early OHT formation. So because we're unable at this point in time to have embedded ethnographers at each of your sites helping with this work, we're hoping that you would be able to help us do this through interviews, perhaps just by telling us stories about interactions you've had, conversations you've had with colleagues, with other partners, with even the ministry, maybe aha moments, just to help us paint these insightful, complex pictures that we're after, that will hopefully be of use to you, to the ministry, as well as to other teams that are starting on this journey. Okay, so who will be interviewed? We were aiming for about 10 interviews per OHT, but this could really be anywhere between 8 to 12, depending on how many partners you have and so on. So we're going to be asking key OHT contacts to suggest 10 to 15 names, and it would be great if you could perhaps suggest 15 names so that we don't have to bother you by asking for more names in the process of doing this, because some people obviously might not be able to participate. So we're asking specifically for the leads from the hospital, primary care, home and community care, the OHT signatory lead, the project lead, so someone in charge of project oversight and coordination, the primary care physician other than the primary care lead, as well as experts in relevant population focus areas that you're targeting for year one. Then a patient representative or advisor, as well as just anyone else who you think has significantly shaped your OHT that we might not even have known to ask about. Okay, so next slide. What will participation involve? So interviews will take an hour, and they will be scheduled at participants' convenience between the second week of January all the way through to the end of February. So they will be conducted one-on-one by telephone or video conference, and that's going to be individual interviewees' preference, really. They will be recorded. Individual participants will remain anonymous. Now, of course, OHTs, while we will not be identifying them by name, we cannot really guarantee OHT anonymity once we describe context, right? So, target population, geography, and so on. So people in the know will probably might know, but we'll do our very best to preserve anonymity as much as possible. Okay, so back to Walter.
Fantastic, thank you so much. I'm so excited about all of our learnings that we're going to share with you in the coming months, right from the surveys, which we've refined down to be as brief as possible, to try and gather as much information out of the documents as we can, and then really to explore with a select set of teams, and just a subset of teams, really the nature and the understanding of how people are coming together, bridging new relationships, and opening themselves up to a new form of care. And again, with all of the teams, with all of you, our intent is to support your work. This is not something we're doing for our purpose. We're doing it for you and to help you advance in your models and learn from each other. So all information gets fed directly back to the teams first before it's shared elsewhere. And then in a blinded, anonymous way, we'll also be sharing across with other parties, including the Ministry of Health, who are supporting this work going forward. I'm just going to preview now for about 3 minutes some of the future work which relates to the developmental evaluation. So people know that this is one step, step one forward on a larger program. And first off is the purpose of the developmental evaluation moving forward is to support the innovation and development and use data to track and monitor adjustments and changes to the models over time. Very iterative. We don't have a completely fixed plan. We will change and alter, as I said at the very beginning of this webinar, our approach to working with the teams over time. And that is really to adapt to emergent and dynamic realities in the complex environments that you're working in. You may change target populations, change the groups that you're working with, and certainly we expect that over time the providers that are involved are changing as well. We'll be focused on implementation of program activities as you get to the front lines and what's enabling those to work smoothly. We really want to find out and understand how changes in activities and processes are occurring, where the barriers, where the accelerators are in this. And again, that information will be shared across teams to help others accelerate in their learning. We view ourselves as facilitators in this way. And really then also to understand changes in activities related to changes in outputs or outcomes. So are the things you're doing making the differences that you expect them to? There will also be evaluative outcomes attached to this, including measuring and monitoring for that ongoing learning and recommendations for adjusting to logic and activities. I just want people to be aware that as we move into the developmental evaluation, that we do have the quadruple aim framework in the back of our minds. And we have this with the intent of bringing it to the forefront as much as possible. And this is still a work in progress. And along these lines, we'll just give you some of the early thinking of how we expect OHTs to be evaluated over the coming years. And that reflects patient experience, provider experience, health outcomes, and cost. And some example measures, we haven't locked all of these in now, but to give you a view that we're being pretty open in our view of patient experience. And questions we might be wanting to know from individuals is how difficult it is for them to access care and other non-healthcare services that they need to maintain their health. So the focus is on health, but we understand that all of care may not be delivered by a healthcare provider. And then, also this one actually comes right out of the healthcare experience survey around how organized would you say all your healthcare is, and we're intending to use that as a backdrop. And also with individuals understanding how well they feel, their healthcare providers understanding their needs. So these are not locked in stone yet as evaluation measures, but I think give you a flavor that we're intending to be quite broad and not overly narrow in our understandings. The provider experience, this is in the space of a to be determined and under development. So we're actively currently working to develop measures of provider experience, both generically for what really helps providers to have an overall positive work experience environment, and also some items that may be specific to coordinating care for patients in the OHT. So people's overall experience of burnouts, workload, whether they feel treated with dignity. These are out of some very generic measures, but also this aspect of do people in the team share your goals for coordinating care? So do they feel aligned and supported by their OHT? Individual health outcomes. We are very clear that what we count to be a health outcome measure is a health outcome measure, and a health status would be a clear one of these. EuroQual EQ5D would be a generic example of a broad health outcome measure. In some cases and in a number of instances, we may be using some proxy measures for health outcomes, such as rates of hospitalization, thinking that if people are in good health, they're not being hospitalized, and that would be then a proxy measure. And finally, we're quite interested in having an overall cost measure around total health expenditures in the vein of per member per month. I'd like to just note that this is not something that we're doing or something that you're doing. It's something that we do together and everyone's involved. And this will really be our catchphrase all the way along the process in this story. A couple key dates to remember. We have requested, which is why we're very popular today, that by tomorrow we would start with a list of key points of contact from each signatory organization. So not the names or contact information for the signatories necessarily, but representatives from the signatory organizations or individuals that were most involved in developing the application. We've pushed up here very close to the holiday season, so we're hoping that we can get some of these names in before the holiday season kicks in, which really for most people will start on Friday. So that's the request date. If you can't meet that deadline, do your best and send us the information as soon as possible. That being the deadline for us to actually be able to get something out to teams before the Christmas break. And that is our intention, is that emails to all of those individuals for whom we have contact information, we will get them out on December 20th as much as possible with the survey link to each of the participants. And again, a reminder that that survey really only takes, we've pre-tested it with members who are involved in some of the early OHT, and it's taking about 10 to 15 minutes. We expect 15 minutes really on the outside for you to complete that survey. And we've been very, very focused on what we've included on it. Just wanted to indicate that we are part of a larger set of resources. And you're going to hear more in the new year. There was a webinar last week that identified that there is a ministry that has a central program of supports. And we just wanted to, on behalf of the Ministry of Health, first to thank the Ministry of Health for supporting all of this work and for supporting the teams, and to point people to the Ministry of Health's central program website. And a few examples of the available resources that are available to teams as of current include the digital health playbook, as you've heard, and you've all seen this. You should all be aware of the Ontario Health Team RISE, the Rapid Improvement Support and Exchange, and many of the materials that we make available will be also mounted through RISE, and you'll be able to access through there. And finally, our own evaluation of the progression of teams in discovery and development, as well as the candidate teams going forward in the coming years. And our information will continue to be available through our own website, but we will also push things as relevant through RISE as well. This was just a bit of background to remind people about some implementation resources that we made available last summer. Hopefully you've all seen these. Links to these are also available from the RISE platform, associated with specific building blocks for each of them. These ones focus around implementation at the organization level, understanding the needs of caregivers and patients, how managers and providers can be involved, and how patients and caregivers' needs can be met with collaborative governance. We see a very strong opportunity for adding one related to local evaluation to this set. So again, thank you everyone for joining today. We are now going to move to reading chats and answering Q&As. Somebody asked about slides. We'll make these available through the ministry, a link from the ministry website, but they'll also be available on our own page that attaches to OHT